TRT World's health correspondent Nicola Hill in London. Nicola, great to see you. Tell us more about this research, in particular the eye protection, which is something that we've been talking a lot about in the newsroom.
Yes, this is one of the measures that this research has actually had a look at. They say that the eye protection the evidence surrounding that is not very strong, but it is giving some protection. It does say that the chances have been reduced a certain amount. And it's very interesting, isn't it? It's because this is the very first retrospective study, one that's looked at all elements that we are putting into place to see if we can reduce the chances of getting the coronavirus if we mix with other people. And as you said there, they looked at 172 studies that have been carried out over 16 countries. They looked at studies that looked into coronavirus, also into SARS and to MERS. And they did find that physical distancing reduced the chances of transmission from 13% to 2.6%, that using face masks reduced it, and as you said, they're using the eye mask. But one of the interesting facts that came out actually was just how far apart we need to be. And there's not consistency about that at the moment worldwide. Here in the UK, we're saying 2 metres. We just saw there in the Italian airports, they're saying 1 metre. And what this study found was that after you've had that 1 metre distance, any extra metre actually reduces by a half the chances of you then becoming infected. And this is because, as we've learned, the virus is transmitted through respiratory droplets when you cough and when you sneeze. And after the 2 metre mark, it's thought they then drop to the ground. And that's why they're saying that that's possibly a better distance to keep. And with the face mask, they're saying that the respiratory masks are vital for people who are healthcare workers and treating patients who have COVID-19. And if we have our homemade masks, they need to make sure that they've got 2 layers of material. Just 1 layer isn't actually enough. But it is important to remember that these aren't going to give us basic protection completely, and that we still do need to do the hygiene and the hand washing that's being told to us all the time.
So that's the research from the Lancet. What happens, how does it get to different countries, and does it change how countries are dealing with the pandemic?
Well, this is a really important question, isn't it, Maria? So this research was partly funded by the WHO, and the researchers have said that they've done this to try and give a consistent message so that countries and governments know what is best to do, having looked at these 172 studies. It should help with modelling in case there's a second wave, and it should perhaps give a consistency, particularly for this physical distancing. But that's going to bring problems. Now, Professor Linda Bold, who's Professor of Public Health at Edinburgh University, is one of many specialists who's actually welcomed the fact that this definitive research has been carried out. But she does say that it will cause problems. It's going to cause problems for retailers if you have to have a bigger distance. It's going to cause problems for public transport. And of course, it's going to cause problems for the hospitality industry that's desperate to open. 2 metres, 6 feet in old language is quite a big gap, and it reduces the numbers of people you can have in buildings, you can have on trains, you can have on planes. But we just now have to find out whether it's something that WHO is actually going to then change its guidance, because at the moment they are saying a minimum of 1 metre. So I suppose they're now going to consider this evidence, and whether it changes guidelines or not, we have to wait and see.
Absolutely, and that consistency in messaging is so important. Nicola Hill in London, thank you so much. See you tomorrow.